Hi, I'm Mary Henderson reporting for Daily Bulletin. I'm talking with Andrew Jayaraja, Research Coordinator at the Sunnybrook Research Institute in Toronto. He's sharing key learnings from his RSNA 2024 session, Opportunistic Screening of Low Bone Density on X-ray, Experience at an Academic Hospital. Thank you for joining me today.
Thank you very much, Mary.
How did the AI tool in your study perform in flagging individuals likely to have low bone mineral density?
It did really well. So we recruited about 1,145 individuals. They all went through a standard X-ray and were analyzed by Roe, but Roe determined about 40% of them were screened to be at high risk of low bone density. So our next phase was to determine to see which patients would undergo a bone density scan. So we then followed those next set of recruits. That was about 136 patients. After doing a bone density scan, about 78% of Roe positive screened women. That means they were determined to be at high risk of low bone density. After having a DEXA, they were determined to have low bone density, so whether osteopenic osteoporosis, and about 69% of Roe positive screened men were determined to also have low bone density. So those are quite good numbers. However, it is a smaller population based on the DEXA recruitment, so we would like to follow up and see further number population.
How might the opportunistic screening of low bone density help patients living in remote areas?
So this is what I'm excited about, and hopefully it's going to be quite beneficial and useful. So we know that DEXA scanners are going to be difficult to be, there's not going to be a lot of DEXA scanners in more rural, remote areas. However, all these areas might have at least a local emergency hospital or any kind of healthcare center that might have an X-ray center, so which is beneficial because Roe just requires standard X-rays. So if Roe could analyze these X-rays and determine a screening, then it could help with radiologists decide a management plan to include the Roe findings, and this information can be used for primary care physicians to refer patients who might actually need a bone density scan.
What benefits might the AI tool offer to aid radiologists in managing workloads?
So it's supposed to be hopeful in managing multidisciplinary workload. So it allows radiologists to screen patients for Roe, while they often might not have that capability of doing so because a DEXA scan is required. So if they just have an X-ray, that's very useful. And then again, as I said before, this could be used to help primary care physicians. So if the Roe score is available to that physician, then they can decide to send that patient for a DEXA, or at least start in the beginning, have the discussion about osteoporosis, risk factors that can lead to it, and discuss about management and treatment plans.
Thank you for your time today.
No problem. Thank you very much, Mary.
For more information about the study, look for this RSNA 2024 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.